Dressing a surgical wound using aseptic non-touch technique. Before you start, check that your patient is ready for their dressing change, they're in the correct position and pain-free. You need to make sure all the windows are shut, the fans are off and the cleaning stopped before you can start doing a wound dressing. This is to prevent dust and loose skin cells contaminating the wound. You'll need a dressing trolley, and you can use a 70% alcohol wipe to wipe the top of the trolley from the centre towards the outside of the trolley. Ensure you wipe the rails, the legs and the bottom shelf of the trolley. You'll need sterile gloves. For non-surgical wounds, some people might choose not to wear sterile gloves but do a non-touch technique using the clean hand, dirty hand method. You will also need spare gauze, your selected dressing, a dressing pack, an Irripod. Always remember to check expiry dates and pack integrity. Also need some non-sterile gloves and an apron. Everything you need should be placed on the bottom shelf of the trolley ready for use. To start the procedure, open your wound dressing pack onto the top shelf of the trolley, this side up. Open it out, taking care to only touch the outside of the blue sheet. Pull the corners out and straighten up the sheet. Put on your non-sterile gloves and break the Irripod. You can then squeeze the saline into the dressing tray. Loosen the existing dressing. You can now assess the wound by partially removing, then replacing the dressing, keeping the wound exposed for as little time as possible. After you've done this, you can dispose of your gloves and alcohol gel your hands. To prepare your dressing trolley, open the yellow waste bag. Use this as a sterile glove to pick up and place the contents of your dressing pack onto your dressing trolley. At this point, you might decide to place some of the sterile gauze into the saline-filled dressing tray. You can then lift off the old dressing using the bag as a glove. There's a very authentic looking wound there for you. At this point, you could turn the bag inside out and attach the sticky edge to the rail of the dressing trolley. If you place the dressing trolley with the side containing the yellow bag nearest the patient, you've got less chance of contaminating the trolley. Now you should open your sterile gloves and place these either onto the dressing trolley or another hard surface that you've cleaned with 70% alcohol wipes. You can then place everything else you need onto the dressing trolley. You can now put on the sterile gloves. To do this, touch only the inside of the first glove. Then make sure your bare hand only touches the inside of the second glove. You can now straighten up and smooth down your gloves to improve dexterity. Place the sterile field underneath the wound. Then, using a clean hand, dirty hand technique, take the wet gauze in your clean hand and pass some of this to your dirty hand, which will be nearest to the patient. Your dirty hand will be the one that comes into contact with the wound, but not with things on top of the dressing trolley. Clean the wound from the inner aspect towards the outside of the wound. Use each gauze swab only once while cleaning the wound. Dry the wound gently by dabbing. And place the new dressing onto the wound. You should now give the patient some wound care advice. Completed the dressing, you should dispose of everything that you've used. Place this yellow dressing bag into a clinical waste bin. Then clean the trolley. Perform usual hand hygiene. And finally, document all care.